Senator Moody, and now Senator Kaine.
Thank you, Mr. Chair, and thanks to all the witnesses. I'm going to get to organ transplants in a minute, but I cannot resist, with 3 liver doctors in the room, to ask a question about hepatitis B vaccination. Last week, the Advisory Committee on Immunization Practices, ACIP, voted to end a decades-long recommendation to vaccinate all newborns against Hep B at birth. Hep B is a highly infectious virus that leads to chronic long-term illness and can cause severe liver damage and cancer. In September, this committee held a hearing with Dr. Menars and Dr. Houri, departed public officials from the CDC. And during that hearing, Chair Cassidy used his time to discuss the importance of Hep B vaccine, sharing his own personal experiences treating patients with hepatitis as a liver doctor. To repeat some of the facts from that hearing, the chairman said before 1991, as many as 20,000 babies were infected with Hep B in the United States. He also shared while that Hep B vaccine is recommended at birth, it's not mandated. Finally, he said now fewer than 20 babies per year get Hep B from their mother. If a child is infected with Hep B at birth, over 90% of them will live with the consequence of a lifelong infection. Now, we often know a mom's Hep B status before birth. Some have asked, why would we vaccinate a child if we know the mother's status? But even if a mother tests negative during pregnancy, it's still recommended to vaccinate the infant because Hep B is highly contagious and can be transmitted through contact with even a minor amount of blood, for example, on medical equipment. Without widespread vaccination against Hep B, numbers will begin to rise again. So a rise in infection among infants will ultimately lead to a rise in chronic liver disease, place even more burden on our already strained healthcare system and organ transplant network, adding to the current 10,000 people awaiting a liver donation currently. Dr. Magee and Dr. Karp, you're both practicing transplant surgeons. Could you describe for the committee what would happen if we stop vaccinating infants against hepatitis B, and what would the long-term impact of that be on the transplant network?
So certainly, more as somebody that does pediatric liver and kidney transplants, seeing anyone develop a disease that we had previously not had to deal with would break my heart. The OPTN, in my capacity as board president, has no requirement about vaccinations going into it for many reasons, including the issues that are very complex. But Chair Cassidy mentioned walking around with a normal liver and a sick liver. It is pretty simple to understand that this causes a problem. So I agree with all your comments.
So no requirement, but a recommendation about best practice.
Well, we don't even make a recommendation in that capacity, but our center would recommend that.
We concur. Thank you. Dr. Karp.
Yeah, so I'm not, to be clear, I'm not an expert in infant vaccination, but what I can tell you is that having done this for 30 years, when I first started doing liver transplants, there were an enormous number of patients that had hepatitis B as a cause of their liver disease, and many donors that had hepatitis B, and those donors were not as usable because of the hepatitis B. That is almost completely gone, and boy, I would hate to see that change.
And that is gone. You believe the prevalence of vaccination is one of the reasons why that's gone down so significantly?
That is my belief.
Yes, thank you for that. During my time as governor, I supported the development of the Virginia Biotech Research Park in Richmond, and I encourage UNOS to move to the city into that park, and it still operates today. It's operated for over 40 years. It's historically played a critical role in our transplant network, and yet I have read concerning stories about failures to protect patients. While Congress has taken some action, more needs to be done, and that's across the spectrum. With over 100,000 people currently on organ transplant waiting list, I'm encouraged by today's hearing. So let me ask just a general question for each of you. Given where we are today, what do you feel is the single most important policy that Congress can enact to further improve our transplant system? And if I could start with you, Dr. Magee.
I think preserving the private-public partnership that has built this system. They're both the experts who do this, that are a self-renewing resource, would hold each other accountable. Ideally, we need to make sure that that happens, and the partnership with the federal government to make things happen, in addition to oversight like this. So I think maintaining that is probably the best thing that can be done in maturing things. I also think, to Dr. Karp's point, which I also agree with, is making sure that everyone has ready access to the data. That data, no matter where it sits, needs to be accessible by all and allowed to be published and discussed in open forums.
Dr. Karp.
I think to improve the system, what we're really talking about is getting more organs. And each limb of the system has had extremely good oversight, except for the OPOs. The transplant centers have had really good, the oversight of the transplant centers has been quite good, I think. But the OPOs have not had that. And that change will, I believe, potentially provide enough organs for every patient that dies waiting for a heart, a lung, or a liver, and make an enormous impact in the 100,000 patients that are waiting for a kidney transplant.
Great. Thanks, Dr. Carp. Mr. Wright.
The most urgent thing is the vote on keeping people covered, but on the organ transplantation system, it's accountability. The industry should not be expected to police itself. And so whether it is the oversight over the OPOs and going beyond just South Florida to other places where they're failing, or breaking up the monopoly contract, or just changing industry conflict of interest in the governance.
Thank you. I have another question, but I'm over time. Senator Murkowski.